Thank you. The injury panorama, yeah, no, it's got to restart for another reason. I have no idea what my computer is doing. But the injury panorama is such that we look at, is a school preparing for natural disaster? What are specifically the challenges in that community, in that part of the world, which is shown more for Form A than from our previous model for the last 14 years, which has been very open and open-ended. We have found that that doesn't work very well because schools have a hard time and governments have a hard time formalizing or formulating what does this really look like. That's why I like that particular video that quit at least now once. Let's see if this thing completely starts up again. I hope so. If not, I'm going to have to do something for my next presentation. But we're moving into a new format within Safe Communities. They've been doing it now for 2 years. They finally have the kinks worked out, we think, according to Goldbrand. And that is utilizing Form A with certifiers who have been through an entire year of specialized training, mostly doing work at home, and then an initial meeting, and then at the very end, an entire 2 or 3 day meeting to discuss what is going on, what has changed, and for everybody to be on the same page. Once this completely restarts, I did it again, hold on. In Safe Communities, and that is Form A. Our Form A will look very similar and have the same definitions, the same keys that Safe Community has. It will just have the additional indicator that is not the 8th indicator, which is different for schools from communities. It's the extra piece. And we still have to, at this meeting, define what the Form A is going to look for that. Form A, for those who do not know, and I'm hoping I can open it, is very, very detailed in that it asks very specific questions with very specific limits on how much can be written into the Form A, with the rest being indexed, which saves certifiers huge amounts of time, because reading one community application with all the indexes took me 15 hours, and I had 3 of them to do, and then I had to go to Shanghai to verify. And the way that Safe Communities is they get, it's my computer. I apologize for it, Mayor. It's going to be one of those days, I think. I apologize to you, Mayor, for the problem. So what we're doing, we're in the midst of change after 15 years. As a organization, moving from kind of a loose, open-ended sense to having things standardized so that they fit better. For example, the Safe School here in Non will fit better with Form A with all the other schools around the world than having kind of the open-ended application that was originated, because there was different expectations from different parts of the world. But now if we have one expectation, we can compare, for example, Lanach, Austria, with Thailand, because the cities are about the same size and the schools are about the same size. The big difference being that Lanach is in the middle of an agricultural part of Austria, and Non is a more of an urban, but yet still a suburban to having some agriculture. And we need to be able to do that because we have inner city schools, we have major universities. So far, so good. So as soon as this comes all the way up, and it'll tell me that in a minute, we will open Form A and discuss that. It is now. Right, yeah. Well, the good news is that we get all the technical problems out of the way on the pre-conference day rather than the rather than when things start at 5 o'clock. See, it happens that way. Since it is 10 after 9, my suggestion is, I'm a big believer in the brain can only accept how much that we can stand being seated in one place for a matter of time. And so I suggest we take a 10-minute break for bathroom, coffee, what have you, and then come back, and hopefully the computer will be happy by then, so we can get back to it. I do apologize. And when we come back, we're going to have a brief discussion about what it takes to form a Safe Schools Committee, what we each think, who should be involved, and how we go about bringing those people involved. I know Non has done a wonderful thing because it has a wonderful mayor who's brought all the players together, not only for safe communities, but for the schools. And I really would like to hear your opinion on that, especially as we have people in the audience today, including a presenter who needs that input for working in the Middle East. So why don't we take a break and see you in 10 minutes. What sort of dangers they face in their community and in their school. And then handle them, how to recover, and then as well as how to avoid so we don't get in problems in the first place. But as we were discussing earlier with natural disasters, we just more need to know the best response rather than avoidance, because we can't necessarily avoid it. On one half of the injury spectrum, we talk about intentional injuries versus non-intentional injuries. Intentional injuries are interpersonal violence or violence turned towards oneself. And in schools, regretfully these days, We not only see fights, bullying in the schools, bullying over the internet, but now we have very, very real issues of terrorism. Whether it's a mentally ill person in China who is disaffected charging into a school with a knife, or children that are disaffected coming in to their school, whether in Scotland, the United States, or Australia, and shooting their fellow classmates or their teachers. We need to know response to natural disasters. That has become a very big issue, especially, thank you, here in Asia. No, just water is fine. Thank you. With issues of tsunamis, the ever-present danger of earthquakes, landslides due to excessive rain, and as we progress with climate change, more and more natural disasters that we never thought of are going to show up. Well, sorry, the wrong button again. Why should the community care about safe schools? Well, we know from a project that was done in the early 1990s that once a school has dealt with changing the safety view in the school and made students happier and learn how to positively communicate with each other, they learn how to behave in society. They decrease vandalism. They behave in stores. They teach adults in the community what is acceptable and unacceptable behavior. Because they are, once they understand that they are making a difference, they're not afraid to stand up to their parents and say, you know, you need to wear a seatbelt, you need to not speed. And that's done basically through social marketing. Just like McDonald's sells billions of hamburgers through marketing to children, we market safety. And when the students have buy-in because they see it makes a difference in their school, they take it to their community. And we know that when people feel safe, their brain is more applicable to positive feelings, less depression, and therefore better able to learn and make rational decisions. Along with that, we have seen over 30 years of pedagogical research that when you have a safer school, you have fewer absentees, not only by students, but by teachers. Teachers experience burnout for a number of reasons. Some of it is workload, but a lot of it is feeling that their students are out of control and the school is out of control and they're making no difference, and that they don't have time to teach. We present them through using research-based programs and having a voice in the programs, effective ways to create time to teach. And when they have time to teach, they have less burnout and they're actually coming to work rather than having to be replaced by temporary teachers who may not be in line with where the students are, or worse, end up acting as babysitters rather than teaching. And for many education ministries, this is a big issue. Better academic performance. As I mentioned a minute ago, we know that when students and teachers and all human beings see less violence and feel safer. Their brain, they're actually able to go away from the fight or flight response, which eliminates access to the prefrontal cortex, to actually reach the executive center in their brain, learn better and perform better academically. And many education departments around the world place a high standard on academic performance, getting students into better universities around the world, or better pay for teachers, etc. And on any of these issues, I've got reams and reams of material, let's see, on where we get this information and how to specifically address the information. I didn't want to bring all that because it would take days. And anybody who knows me knows that I can speak about this for days, with or without slides. So, over the last 2 years, the Safe Communities movement has led the change to what is called Form A, which is a very specific application form that asks for very specific information, and we'll look at some examples of that in a minute. But last year in Lidköping, right? What city were we in Lidköping? The first class of new certifiers and the provisional board got together over a week and went through each of the parts of the form and came up with questions that we are looking for as safe communities and safe schools to see when we are looking to evaluate a school or a community, and what we need to be aware of regarding whether a community or school, this is mostly community based, has, you know, does the community have the ability to change and power on physical planning, social welfare, local roads, traffic regulations, the fire, the police, local education control, health service, public transportation, business development, etc. Because if a community doesn't have the power to regulate or increase those areas, or a school doesn't have the power to change programs it brings in, we can't expect those things to be dealt with. But what I found in Austria this past year, where the schools have nothing to do with the busing. The schools are only responsible from when the students are on campus to the time they leave, not including coming and going. We had a discussion with local education ministry about having the discussion with the bus driving companies of, are all the students buckled in, they know where they're seated, and that was all very clear that they're very good about that. But I noticed a very small, maybe 40-pound young girl getting into a minivan which doubled as a school bus, and she was responsible for closing the door. Well, she wasn't big enough to close the door. She almost caught her arm twice. And so I said, wait, this doesn't work. And they said, well, you know, we're doing student empowerment. Well, yes, you can do student empowerment, but you also have to look at the physical abilities of the children. You know, if somebody is too small to close the door, you can't expect them to close the door. The driver can step out of the car for a minute, or somebody larger can close the main door rather than causing severe injury. So we are looking for, first part of Form A, the definition of what is cross-sector collaboration. And we normally mean collaboration between public sector, private sector, NGOs, and business sector. Inter-sector collaboration, we mean collaboration between the sectors in the public sector. And inter-sector collaboration, we mean collaboration within one sector, for example, within the fire department, or within the police department, or within the mayor's office. We look at about the program. Yeah, sure. I can give you the actual Word document. This is broken up. And let me take a minute to show. Yeah. Open up the actual Form A example. This Form A is from a community in Shanghai that was designated at the end of last year. And we can go back and forth. Form A is the base application, as I said. And the first part of any application for schools or for communities is we want to see an overview. We need to know what the history of the community, where it is, or the history of the school, where it is. That gives us an idea of the size, the scope, what ability they have, the number of people, the playgrounds, medical institutions, so that we can look at what we can expect from that school or from that community. If they have 13 students, we can't expect them to run very large-scale programs, but we can expect them to run small programs that are very, very effective. Sorry about that. We want to be able to describe strategy, ambitions, objectives, and work in the school or in the community in regard to safety. This is the reason I like Form A is because it breaks down very specifically what we really expect to see as a movement, rather than having these amorphous indicator one, overview indicator one, form a safe community collaboration and define the safe community collaboration. Well, as people that have been doing this for 20 years, we know what we want. Communities and schools don't. And so we need to give them very specific pieces because it standardizes. We want to see the vision of the safe community movement, the objectives, how the group works, the mayor's role or the principal's role in case of schools, and who is chairing it, and how it works. It makes it easier for everybody to compare and contrast. The injury risk panorama, which we've spoken about, because we don't necessarily know what a community is facing or a school is facing, though we do have a good idea from national and international data, but we also want to know that the school and the community understand from their base data, from their baseline, what the panorama of injuries, what they see in the injuries of the community. In this case, Jianpu Road has a lot of elderly retired persons. And so, since they can contain 71% of the population, they have the highest risk of injury and need the most attention. And under each of these, we expect to see vulnerable groups, etc. Let me go to one more document. I didn't want to do that. As you see from our notes, as a community, as leaders of the project, for where Jianpu Road gave you the example of how these questions were answered, these are the questions we're looking at. And I think the more that we share these questions directly with the communities and directly with the schools, the better they can operate and that they can respond to us, and we can actually have a good, positive conversation rather than trying to, after the fact, say, why isn't this there? Or what are you missing? What's your misunderstanding? Because we have learned that that's how things work without these questions. So in indicator 1, we're looking not only for what the safe community group does, but how they work. Do they govern by objectives? What do they use to incentivize changes? How do they formulate regulations? And this can be done very succinctly, rather than giving us a large amount of data that doesn't guide us. And I want to thank Shrikant Bangdalwala, I always mispronounce his name, for typing these up from our meeting, because it made it much easier. For example, what in the program higher safety than is in the normal community, so that we know that the community knows that they're expected to be, the community in the school is expected to go above and beyond what they currently have, not just change their attention and conversation about being concerned about safety, but actually going above and beyond what their experiences in other communities and schools in the area are the experience. And you'll see the last question that we look at in indicator 1 is how the Safe Community leadership group deals with continuous improvements. Is this a continually sustainable total quality management system, or isn't it? Because if it's not, then we have a conversation about what the purpose of safe communities and safe schools is. Sorry. We have about 15 minutes before our esteemed colleagues have to go on. And she's so thrilled about going on. Indicator 2, which is what sort of programs are in the community or in the schools. And we want specifics. We want what the school is doing on suicide, what it is doing on bullying in the schools and on internet. What is it doing about sport injuries in the schools? What is it doing about slips, falls, etc. And the list is longer, of course, for communities. And what is it doing about teaching, avoidance, what is it dealing with natural disasters, etc. Indicator 3, all vulnerable groups, we want to know they're identified, why they're vulnerable, and what population are they, what percentage of the population they exist, and what is being done for them, and more importantly, what is not being done. A general thing in schools could say, for example, that the handicapped students are the most vulnerable group, but the data may say that 12-year-old boys are the most at risk for injury. So when somebody just assumes from prior impression that the handicapped students are going to be most at risk for bullying or other injuries, that may not be true. And this is part of why we ask, why are they considered vulnerable? And what makes them vulnerable? And if we, as certifiers, look at the various groups that are mentioned in the checklist that is given to the communities with Form A as to what we're looking for, if they're not mentioned, we want to know why. Does the data say that they're not at risk? Or are they just not mentioned? And big example in Australia and the United States would be GLBT students. In some schools, they're not mentioned for religious reasons. In other schools, they're ignored because of political reasons. And if that is the case, we want to know why, and so that we can come back with the data and say, this is an at-risk group, and for very serious reasons, why are you not addressing them, and what can be done to address them? And at times that can be a very difficult political conversation to have. As news reports out of Australia prove that there are some, I guess, very interesting national arguments going on about that today. And we want to separate out what the Ministry of Education, the national or state ministries, or in case the government, larger government, does for the local community and schools, from what the local community and schools are doing. And again, we want to be aware that we don't want just the social welfare definition of vulnerable, because it includes non-injury mechanisms for vulnerability, such as income, etc., and doesn't address vulnerability from an injury perspective. We also are looking at environments for schools, their buildings, their playgrounds. And these are just more research things that we're looking at. I'm more than happy to share all of these documents with everybody. I apologize for not having them printed out and on separate drives today. My computer dying did not help. Because as we have the form, I think that the mayor can support this. It'll make it easier for schools to apply, for schools to understand the program, and for communities to do the same. Again, it's about 10:30. I think we're about ready for another 10-minute break. Is that correct? You want to keep going? Take a break so that you don't need to continue to nap or go to the restroom. So why don't we take a 10-minute break? Hi, Christoph. And we'll be back. For those who are going to be stuck in meetings all afternoon, that may not be fun. We'll try and be done a little before 12, like at least probably in a little under an hour. So indicator 4. Why do we want evidence-based programs? Well, both at the community and school level, I can talk with great passion about proven programs. Having been developed one for the schools since the late 80s, and that has been studied all around the world and has quite a bit of proof for changing the risk and protective factors for drug addiction, interpersonal violence, etc. We know that these programs, and we've known for 30 years, 40 years in the scientific literature, that a lot of programs that have a very good thought model behind them, they're expected to work, they don't when they're implemented. The biggest example that I always use when I talk about schools is the DARE program from the United States, which is DARE to keep your children off drugs. The DARE program was developed at the cost of about, and implemented through school resource officers and police departments throughout the United States at the behest of the Reagans, at a cost of over $2 billion, US dollars. And when they studied the DARE program, it actually had the opposite effect of the intended effect. It actually increased drug usage, more drug usage of hard drugs, because the program basically taught students, well, these are the drugs, these are what they do to your brain, these are how you feel on them, and here's where you buy them. So don't do that. Well, you know, for kids who didn't have an idea of where to buy drugs or what they did to you and what they made you feel, suddenly you had all this information and they acted on it. So when I talk to schools and I talk to communities about research-based programs and proven programs, I'm not so concerned about programs that have any cost or are free. I'm more about, rather than taking something and recreating the wheel of, you have a problem with school bullying or cyberbullying, rather than creating your own program from start, which costs a lot of time and energy as well as money, look out into the research or contact local university or your support centers around the world, or with schools you can contact me directly. We can put you in touch with evidence-based programs that have been proven, maybe not in your community, but in communities and countries very similar to yours, and maybe all they require is a little bit of tweaking to fit your exact school. Because we don't want communities and schools spending their time, spending their energy, and spending their other treasure on things that don't work, or on recreating what we know works. This indicator was added about 5 or 6 years ago now, because the World Health Organization's Violence and Injury Prevention Division at the time came to Safe Communities and Safe Schools and said, well, we have all this evidence of programs that work, but Safe Communities seems to have a lot of things that are, created on a local level that don't have proof that they work, but yet there are these international programs that have been proven to work. Why aren't they using them? And a lot of it came out of the fact that Safe Communities and Safe Schools was meant to enable schools and communities within their own resources to solve their own problems. But one of the things that lacked in schools and communities when we were moving along through the development and growth of both Safe Communities and Schools was that communities and schools don't necessarily have the experience or the person power to go out and see what works. Or maybe they don't have the expertise in-house to go out and read hundreds of documents and papers. And I point to a community in Northern California called Salinas. In 1995, Salinas, California was dealing with issues of school violence, truancy, and vandalism. And they convened a panel of 26 experts from around their community and outside their community to look at what worked. And this panel spent 2.5 years looking at the evidence. And they found 3 programs that fit. And they did 3 different implementations, and one they decided to grow. That happened to be the program I was involved in. But it took them a tremendous amount of time to find out what works, when those of us who are dealing with it day to day could have said, well, we know that this works in this situation, that works in that situation, without having to recreate anything, without having to come up with anything new and inventive, but just look at what we know works and what's available in various languages, etc. So that is the impetus behind Indicator 4 and why we are looking for proven programs. It may seem to schools and communities that it is an extra burden, but actually it's designed to be less of a burden and more of a bonus when looked at from effectiveness and inputs versus outputs. It is noted that in our movement, we are developing rapidly practice-based evidence, where communities and schools who have done promotion practice for years and they know what works, they need to share it. Because if they don't share it and document it, which is the last indicator, we can't say to other communities or to other schools, this works in practice for this situation, for this size community, this size school, with this sort of demographic. That's why part of that indicator of sharing on the local, national, and international stage of programs for both schools and communities is so very important, so that we can help build practice-based evidence. Now this, I'm not going to go into great detail about Indicator 5 in data. It's more effective if you read through Professor Shrikant's notes, because he is the specialist we look at within the Safe Communities and Safe Schools movement on data and evaluation. He is one of the leading experts in the world, and he has done all of this wonderful work for us. So rather than say, well, why do we, what's available to a community, what's available to the school in terms of sources, how do we do data collection, how do we do evaluation, and as I noted, all of these will be available both on the internet and electronically, and for the Thai members, I will figure out how to get these printed and into the hands of Mr. Choslip or somebody with the conference to be able to be duplicated and put into the hands of those who would rather read English than listen to me drone on. So I appreciate all of your patience. This nice but very large table gives a very, very concise idea on data evaluation, data collection at the community level, and it's very similar for the school level. In translating it for education point of view, for what is being collected at your school level, I'm very easily versed in doing that. Then quality evaluation based on the sources of data is judged by the experts rather than me, specifically because I'm not an expert in evaluation. I'm certainly versed in it, but it's not my specialty. But we don't expect it to be the specialty of communities or schools either. That is why we have put together this table and made it easier for schools and communities to make decisions. And we also suggest that you work with local experts in epidemiology to do further in-depth research. But the in-depth research and evaluation isn't the point. It's to be able to understand the data and interpret it versus your programs to figure out what works and what doesn't work. And that's why we ask these questions. How is the data collected? And is it likely to be good? And we can see that from the above, some of it from the above table. Is the data translated into information? This is a good question. My mother was a high school teacher for 40 years. And she and every one of her colleagues complained incessantly that they collected all of this data and nothing was done. It was put into a file cabinet. They spent hours and hours and hours collecting it, and it did nothing because it wasn't translated into information. It wasn't evaluated in any way. It was just about getting data. So we want to know that data is translated into information for the school, for the community. We want to know who's in charge of gathering the data, who is in charge of summarizing the data and creating the information, who's in charge of interpreting the data, and how often is it looked at. Very important, how is the information used? If we're just collecting data and evaluating it and putting it into a file cabinet and not even bringing it back to our safe community, our safe schools coordinating group, it's not doing anybody any good. You're wasting time, you're wasting energy, and you're upsetting people ultimately. And so we want to know how it's being used. And then we want to know how it's being transmitted to the school and to the community. And how important and that it's presented in a way that as many different actors and different stakeholders in the community and school community can understand it and bring it into their daily practice. And sometimes communities and schools have plenty of people that can do that. Even schools use fourth graders to do the basic math, some of the basic math for evaluation, and have them report it, which is a great mechanism. And then at much higher levels, they would use people like Professor Grivna, Professor Lee, et cetera, who are experts in epidemiology and publishing on an international scale and in scholarly journals. But it's just as important to be able to use it locally and have it be understandable locally. So indicator 6 is evaluation. And we want to know how the evaluation is performed. Does the community evaluate both the result and the processes? How are the objectives evaluated? To who are the results of the evaluations reported? Who are the people responsible for the evaluations? Is it just the school nurse? Is it a group within the community that does evaluation of programs? So that as certifiers and as a certification organization, we know who to go to have those discussions. And even more so that the community understands who to go talk to understand what the evaluations are saying. And one thing that comes up often is many programs have their own evaluation, and we need to know that. So is the evaluation being done centrally, or are they being done in pieces and parts by different programs? And then, especially at the community level, and even at the school level, we want to know if internal auditors are engaged to make sure the data and evaluation is being done according to specification and et cetera, and whether external experts are engaged, such as Professors Lee and Grivna and Bangdalala, et cetera, who can help guide that. It's important to note that Safe Schools has 8 indicators versus 7 because we split out when we're looking at vulnerable groups, et cetera, for the schools, because there are just more schools, more groups that need to be looked at very specifically within the school community. But the same basic 7 apply to all programs within safe communities. So when we look at 3, 4, indicators 2, 3, and 4, those indicators cover 2, 3, 4, and 5 in safe schools. All safe communities are models for other communities, just like all safe schools are models for other schools. And there's been a huge development of safety over the 35 years of safe communities and 15 of safe schools. And we know what works, we know how to support each other, and we need to collaborate. And not just at the certification level, not just at the supporting level, but schools and communities need to talk to each other. Whether they come to regional or international meetings to meet one another, or they find each other through the lists on the internet, people in other countries, and start internet pen pal organizations. And they need to tell those of us who are in charge of supporting the certification and supporting the implementation of safe schools and safe communities how to support them in collaboration. So we know that because of collaboration, they can go to communities and schools that have already been through the process the first or second or third time. They can use those with knowledge to find partners to share their workload. And we're also looking to have communities and schools benchmark special areas. For example, researchers like Professor Lee are doing, as he mentioned at the beginning of, or about half an hour into our meeting today, doing controlled studies, which are for the good of the research community, but ultimately the good of the safe schools themselves and the safe communities themselves. But we need to keep, as an organization, our eye on helping the schools and communities implement the process and continue to grow the process while the research experts do the higher level research. But that can be helped by schools and communities benchmarking specific areas for that evaluation and super evaluation by organizations such as Cochrane, et cetera. One of the three of the other things that we decided at the last meeting, but have really been in play for 30 years, is trying to arrange arenas that communities and schools can meet and discuss needs of development. The international meetings, up until about 5 years ago, have been wonderful, but it's mostly been presentations by researchers or researching students about their community projects or a particular project, and not about stimulating conversation. We are trying now as an organization to have, at the larger meetings internationally and at regional meetings, to have roundtables of specific groups such as mayors, such as school nurses, such as principals. And the reason we didn't get it done for this meeting is because principals and teachers, et cetera, need much more preparation time than we were able to give them. And because of budgetary constraints, need smaller regions. And we're still trying to get a handle on how to do that, whether it's through education organizations who already have national and international meetings, or how to do regional meetings that work for the schools and work for the communities. So anybody who has ideas, we need them. We need to figure out how to solve those problems. Now, here is the first mention of Form B. Form B happens after the review for certification. And it's a summation, an electronic web-based summation of what the community or what the school has done. We've always asked schools and communities to put a link to their website to highlight what's going on in their community and safety or what's going on in their school and publish their application. Now we publish Form A as a link, but Form B is actually like a 10-page HTML page website that sits on our website to highlight each community. And that does a number of things. It stimulates the sharing of what works for that community and for other communities. It stimulates, for communities and schools, which is always a good idea, tourism, interest in places that people have not been. Without safe communities and safe schools, I can say I probably would never have ended up in non. But I can say that about many places in the world that I've been, thankfully, to this movement. But we need Form B to help communities and schools stimulate people to come and visit and exchange because they know what's working and they have this advertisement or marketing opportunity, which they can get support usually from not only the government, but the business sector. Business sectors love to advertise, and they usually have pretty large advertising and marketing budgets compared to social good or NGO budgets. And Form B is an opportunity to engage your business sector and have them put up money because they get to put their logo on it and link their logo to a program that they know works and that highlights the communities they're in. And that sort of relationship can build finances to continually support the sustainability of the programs, both at the school and community level, which I believe Dr. Gustav Dalal will be addressing later in the meeting. I can't remember when, but I remember seeing it on the schedule. We want principals and mayors in the regional and international meetings because they're the key people to share what's going on and to share with their peers rather than just the researchers or the people from public health that are doing implementation and support. But a mayor speaking to a mayor is much different than me speaking to a mayor as an expert in school safety and community safety, or Leif speaking to a mayor. A mayor speaking to a mayor has much greater power. Same thing with a principal speaking to a principal, a teacher to a teacher. They speak a common language, they share typically a common history, and there's greater power in those conversations and greater rapidity in sharing what works, etc. That is the summation of Form A, and the implementation of how a school goes about and a community goes about starting the program and getting through to the first certification. And then the last portion that we spoke about was how we continue on into the future. Are we sharing our work? Are we continually taking an annual survey of what's going on in the community and the school to see what's working and what's not? And what are we doing to promote that? As schools, every 3 to 5 years, continue the program, they're asked to send in a reapplication for redesignation, but we expect it to be more of a summation of what's gone on rather than a full-blown application, so don't worry about the great workload. And it becomes a time for us as a certifying organization to check and make sure that the community and the school is continuing on in their work and that they can serve as a source for other communities and other schools as inspiration. That's the whole point behind recertification. Additionally, my experience over the last 30 plus years, it's scary how 5 or 10 years it gets added on whatever seems like every 5 minutes, but my experience is that when leadership changes in a school or in a community, programs or entire movements get swept away or are continued because of the efficacy and the buy-in by the great proportion of the school or the community. And if leadership changes cause, to our chagrin, the loss of commitment to safe communities and safe schools, we don't believe it's in the interest of the community or school to be listed as a resource, because people will contact the new administration, and the administration will say, what? And it doesn't make them look good, and it certainly doesn't support collaboration and growth of the movement. We certainly don't want to say that for whatever reason, schools or communities that are struggling to do the paperwork but are still working on the movement, we don't want to disqualify them. Those we can have a discussion with to make sure that the paperwork and the commitment are met to a degree, but the important part is that they're still being active in the total quality management model and are deserving of the international designation. As it is 11:25, and I wanted to be done about 11:30. Do we have any questions that I can answer now? And you can ask me throughout the meeting. Regretfully, I forgot my cards, but I'll email all of you my contact information this evening anyway. And I will provide the printed copies to Mr. Trusup hopefully tomorrow morning. And electronically, I will email all of you. Any questions? Well, I thank you for your commitment and attention this morning. I also thank you very much for your patience with our technical difficulties and our growth. And I want to thank all of you, because I know everyone in this room has been involved in the Safe Community and Safe Schools movement. And it's without you, we wouldn't be creating long-term change in the world. And even when you're working in your office and kind of discouraged at paperwork or emails or whatever is the daily annoyance, you can be assured that your work is causing real positive change for everybody that it comes in contact with. It's not just counting, budgets. It's not just, making a presentation. My greatest joy is to go visit a school or a community and see what's working, because it completely re-energizes me. But just know that you are creating that change in the world, and you're changing the lives literally of millions of people for the good, for the long term, not just 18 months, not just 3 years of a project, but many, many years in the future. So thank you very much, and I look forward to working with all of you. Thank you.